Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Aren't you
therapist.
handsome? Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Okay, Brad, today we're going to talk about if you dislocate your kneecap or your patella, you know, what you need to know, and are you going to need surgery?
Sure.
So, quite often what happens, the way a person dislocates their kneecap, here by the way I have a kneecap of Bonaparte or bonehead, whichever you call them right now. And the kneecap, actually, many of you don't know this, but when your knee is bending and straightening, the kneecap is actually moving up and down in this groove here. Can you see that, Lonnie?
Right here. The femoral groove.
Yep, so it's moving up and down in there. Now what happens is, if you have your knee slightly bent, and a lot of times turned in like this, yep, what we call valgus, that puts your knee at a more risk for dislocating the kneecap. And the kneecap almost always dislocates to the outside, this way, yeah. Very rare. The only way it goes in is actually if you've got some defect, or if someone maybe hit it with a helmet in football or something,
sure,
you know, made it go that way. So it's going to dislocate this way. And what happens when it does that, it actually can tear some structures here. So Brad's going to actually show that, because this is one of the indicators. If your VMO, the muscle here, your vastus medialis obliquus, that's part of your quadricep, kind of that teardrop right here. If that gets tore really bad, there's a defect in it, they probably are going to do surgery. Or, this is a mouthful here too, medial patellofemoral ligament. This is the ligament that helps hold the kneecap in place. So it goes from here over onto the femoral bone here, helps hold it in place. If that's got a big defect in it, a big gap in it, they're probably going to do surgery. Right. The other indication for doing surgery right away is if a little piece of bone fragment gets broken off and it's sitting underneath the surface. I mean, you're just not going to be able to survive it. You know, you're going to have grinding, and so
can't have a floater in there.
No, you can't have a floater. Other reasons, if the kneecap is subluxed or out of place and they can't get it back in place, or it's really prone to doing that, they're going to probably do surgery. If it's, I know we're talking about people this has happened to the first time. If it's happened more than once, you're more than likely going to need surgery.
Sure.
And the last reason why you might have surgery is if you really are involved in sports with high athletic demands.
Right.
So if you're a high-end football player, and you're going to have to you're a running back.
Right. Professionals.
Yeah.
You know, if you're in high school, you just may not do the sport anymore.
Right. Exactly. So, all right. Basically, for the vast majority of people, though, conservative treatment is going to be the first issue of choice.
Right.
So they're going to try some physical therapy. They're going to keep you immobilized for probably 2 or 3 weeks, and during that time,
in other words, a leg brace, knee brace.
Yeah, knee brace. They got a brace that is made just for this problem, and then they'll start doing some strengthening where they're trying to strengthen the VMO, especially
That quadricep muscle.
And we're going to do a video on that. We're going to show you 3 exercises you can do to strengthen the VMO. Now, what are the things that might put you at risk for dislocating your knee? I thought we'd just go over a few of those. One, the shape of the groove here, which you can't control that.
That's
obviously.
genetics.
Yeah. 2, if you are, especially in women, you have what we call a high angle, Q angle. It's just the natural angle here between your knee.
They might call that knock-kneed.
Yeah, exactly.
Because your knees come together before your feet.
So this angle right here, women, it's a normal angle is 17 degrees. If you're a lot above that, you're going to be at a higher risk. It just makes it a lot easier for the muscles to pull the patella right out of the groove.
Right. And we don't, that's just the way it is. Women have a higher Q angle than men.
Yeah.
They know that.
If you're flat-footed, it just changes the whole biomechanics of the knee, and it can make you more at risk. If you are flat-footed, that is something you may want to get some type of orthotics so that you're not flat-footed to help hold the arch up so that you're less likely to have problems.
That's another video.
Yeah. If your patella or your kneecap tends to run a little bit high, and we can tell by looking at it, I can tell by looking at someone whether or not their kneecap's high, it doesn't stay in the groove as much, and it's more likely to dislocate.
And what's the name of that?
Patella alta.
Patella
alta. Maybe, I don't know, alta heights. I don't know what alta means. All right. So if you're going to have, like I said, we're going to do a video now on the 3 exercises for the VMO, and these are the exercises you do after you've been immobilized for 2 or 3 weeks. Before that, all you're going to be doing is what we call quad sets, where you're tightening the muscle, or you might be doing a few straight leg raises. Like
right, because you got that brace on, it needs time to start the scar tissue in the right area.
Yeah, it needs to immobilize and heal. So, all right, watch. I'll link up to the second video too here. So.
Yeah, and then subscribe, because we got more videos like this. And some of them are really good, and some of them are boring, but we try our best, so keep on going, subscribe.
And remember, we can fix just about anything, Brad.
Except for a broken heart.
But we're working on it.